Well, hello and welcome to my YouTube channel. Zeti here, and as usual I'm super excited to have you on the platform. And in case you have never been here, well, don't get confused. This is Zeti. Here on this channel we discuss health, lifestyle, and everything that is just coming up in the medical field, so that you can fill in one another and stay healthy. Okay, so I had started a series on application into the medical courses, like taking up a medical career, especially for those who have never done anything medical and it is your first time you're getting into it, so you might have to sit up and know what we are talking about. So we had already done the undergrad admission. That was our first video, and then we came to the second video, which discussed about the Kenya Medical Training College courses and their admission processes. And now today I had promised to come back just to give a small digestion of what these courses entail, and also the career path you might take in future once you qualify as medical personnel from the Kenya Medical Training College with your diploma or your certificate. Okay, so those two areas are the ones I'm going to focus on. And as we said, our diploma courses take 3 years and our certificate courses take 2 years. So I'll go straight, and then we'll just go chronologically on how it appears on the Kenya Medical Training College advert. Okay, so our first course is Diploma in Nutrition and Dietetics. Nutrition and dietetics entails things to do with diet, like food, how you portion your food, how you eat your food, what are you supposed to avoid with such and such a condition. Yeah, so the personnel who will always walk with you the journey of either losing weight, if you want to, you're overweight, obese, you want to lose weight for your own health, they will walk with you the journey. In case you've been diagnosed with a condition that needs a nutritional support, like chronic conditions, hypertension, diabetes, diet, like things that can be improved with diet, you can be advised on what to eat, and also how to portion it, and the nutritional contents that you're supposed to be taking. Okay, so the end game for this is to become a nutritionist, and you can be either employed immediately after you finished into a nutritional center that deals with feeding, or a feeding program, which in an NGO like the World Food Program, an NGO that deals with children, mostly like malnutrition and everything. So you will be focal people there. Save the Children, UNICEF, these organizations that basically deal with childcare. And then you can advance and do a degree in nutrition, or you can change and just focus on either diabetic nutrition or hypertensive nutrition, or whichever nutrition level that you want to focus into. Number 2, we have Diploma in Clinical Medicine. Here you will qualify and become a clinical officer, and these are courses that are these are employment opportunities that are available within East Africa generally. Yes, so past East Africa it is hard to find a clinical officer, but Zambia we have clinical officers. So East and Central Africa actually, yeah. So for clinical officer, basically they are diagnostic officers. They sit in the outpatient department under like the medical officers. Yeah, so they work together with the medical officers, and then they are into diagnostic and prescription department. So most of the time when you go to the outpatient facilities of a level 1, level 2, or level 3 facilities, you will always find clinical officers. Yeah, first people you will meet once you step into a medical facility, they're like primary health cares. Before they will diagnose you for this ailment, that the common ailments, and then if there's anything they cannot handle, they will refer you to either a specialist, or they refer you to a medical officer for further checks. Okay, so clinical medicine also has minor surgery with stitching. When someone is cut, they can also stitch. They can do that, in minor operations. Yeah, For clinical officer, the career path, you can either specialize or you can come out and decide to open your own clinic. After you've practiced for a while, you can be allowed to open your own clinic. You'll have a license to open your own clinic. And then you can as well advance into either becoming like a child specialist, clinical officer, child specialist, or ear, nose and throat specialist, or skin specialist of clinical officer. Or you can either become, right now we have orthopedic or clinical officer, obstetric and gyna. It is a faculty you can enter into if you fell less of points for entry into medical school. As a graduate, then you can get into Kenya Medical School at that level, because the work scope is more likely similar, but the scope for medical officers is a bit higher. Advancement, you can do the higher diploma in those areas that I've talked about, or as well you can decide to come out and do either psychology, because you will be allowed, given that you have a medical background, you can do psychology or psychiatry, or you can just do public health, yeah, you can do community health, you can do environment health. All those things can be a stepping stone into another career for you. Okay, number 3, we have diploma in health records and information technology. These are medical data handlers, and they stay in the medical records, yeah, whichever form of records, either hard records or soft records, they're in charge of the medical records, and they are very instrumental when it comes to research and when it comes to hospital data. Okay, so when you want your medical history of that, when you've been going to that facility, they're the ones who will bring it up for you. And career advancement, they can advance and then, or they can get out into research, or they can become monitoring and evaluation officers. So it is also a good career. Number 4, we have diploma in medical laboratory sciences. Medical laboratory sciences is basically those who sit in the laboratory department, that is diagnostic, where you take your sample, your doctor has written for you, you need to have your stool checked, you need to have your blood checked, you have a swelling somewhere, they take a biopsy, you send it to the lab, and then they have an analysis of it. They are very instrumental in the diagnostic department, so they will really do an analysis of all the sample they get, and then give the doctor feedback for them to be able to, for you to be able to get care, or for patients to be able to get care. Yes, so they're very instrumental. They can do go ahead and do a higher diploma and specialize either into biochemistry, they specialize into molecular science, or whatever it is department. Then you can go ahead and branch out and just do a specialty into one of those areas. Okay, so number 5, we go to diploma in physiotherapy. Diploma in physiotherapy. Physiotherapy is a physical therapist, yeah, people who will rehabilitate you into your almost being the same as you used to be, especially once you've had like an accident, you've had like trauma, you've had let's say like you had a stroke. Yeah, the physical therapists are the ones who will start rehabilitating you into, take you step by step to coming back to your feet again. So they will do the exercises for you, they will do the turning for you, they will help you into building up the muscle again and reminding your body again how to work the way it used to work, or more so using your other aids to be able to facilitate your movement. Okay, diploma in medical engineering. Number 6, medical engineering are basically the people who deal with medical equipment, on setting them up, maintaining them, maintenance of those equipment, and teaching even the people who, like the medical imaging people, how to operate them, and also being able to recommend what will work for this facility and what will be needed for this equipment to be set up in a certain facility. Okay, so number 7, and their career advancement, still you can do a higher diploma, and then you branch out and specialize into a specific equipment, and then you can be able to assist in the hospital settings or in the manufacturing settings. Okay, we have diploma in public health. Number 7, public health is generally the health of the public. Okay, These are preventive, like primary preventive cares. They always analyze the pattern of diseases, and then they will give a report to the government, to the health sector, that this and this disease has been having this and this a trend, and we're expecting for it to happen this and this a time. So let's take preventive measure. Let us give the mothers and small children mosquito nets. Okay, let us have the dams being oil being spread in dams so that we don't have spread of malaria. Okay, in certain area, let us limit movement to such areas because there's a prospective outbreak going to happen. Okay, and number two, they are the ones who are in charge of giving licenses for food handlers, because once you want to handle food, you need to be certified, and two, you need to have your people checked. So if your staff, especially the eatery places, are supposed to go to the public health for them to be sent to have their stool checked, so that we eliminate these other contamination that can come into to contaminate other foods. Yeah, and also they inspect facilities eateries before they are opened, and recommend. And even how the hygiene of the place, the toilet, how many toilets you need to have in such a structure, they are also brought in. They are brought also on board when such a decision is being made. And also now that we've just had COVID, there were key people in advising the government in whether to shut down, given the trends. And that is why we used to have like daily updates on how many cases have been found positive, how many are recovering. That was in their docket, so that they can be able to analyze and see, is this outbreak going up, and do we need like to shut down some areas? Do we need to shut down the whole country? They were in charge of it, and they're the ones who are advising the government on what to do. So it is a very important it's a very important career. It's a very important course for the government itself, and most of the time you'll find them at the border points, because they deal, and they are in charge of also immunization, preventive immunizations, and they're the ones who bring up all these campaigns on stop polio, those things, because they know how the trend has been and they know what is happening. So they will always advise, and they will always know when to bring in the immunization and when to stop it, such things. Okay, so in public health, it is versatile. You can be employed anywhere in the world. You can as well advance, get a degree in public health, and then do a master's and specialize either in epidemiology, study of disease patterns, or you can specialize in public health and population health sciences. So that 9, we have number 8 is diploma in health promotions, which lies almost like public health, but is slightly under, has a different scope in just promoting health, health living and all that. Yeah. We have diploma in medical social work. This is a very important department in every medical facility, especially the government facilities, that is never utilized. Like, many people don't know how important the social department is, because with social department, it connects the patients to their financial issues, to their social issues. So the social work department is the place where, when you have been admitted and you're not able to pay your bills, they are the ones who you will go to talk to, and then you'll come up with an amicable way of how you're going to pay this hospital bill. And they can even do a research at your home and know if are you lying? Maybe you're able to pay, but you're just refusing to pay. They will do an analysis with the community workers, and then they'll be able to either waive even completely your bills, or especially for the people whose patients died in a hospital and they're not even able to pick the body because they have a medical bill. So with that, they can be able to come in and even waive some bit of the bill, or they just waive the whole bill. So it is a very important department that deals with the humane part of medicine. Yeah, other than the treating, what else are you going through? So they will be able to cushion you from these other things that will hinder you from recovering well or give you more stress. The career path, you can do degree in social work, master's in social work, like that, and then you advance, you become a consultant, and you can be employed everywhere in the world. Social work is versatile. Diploma in occupation therapy. Occupation therapy is they deal with like people who are born with congenital malformations, who are born with congenital conditions that might hinder their milestones from happening. So they come in, they try to set up some exercises, they set up they give you some things that you can use. Either the child is not walking well, or the child is not walking on time, is not attaining their milestones. So they come in to rehabilitate from there. And then with time, they will teach the child to use the muscles they have. They will teach the child to brain function, yeah? Like children who are born with cerebral palsy, their milestone usually delays, so they'll come in to try and help them, those who cannot talk, to bring in speech therapy, yeah? And children with hydrocephalus, such things. So they are really helpful in rehabilitation and helping these children with the issues they have around their own being, and they're very, very instrumental. For occupational therapy, you can as well do a degree and then you go do a master's and specialize in a specific area. It is a very versatile diploma, and I can advise anybody to take it because it is not even flooded in Kenya. And then we go to diploma in community oral health, diploma in dental technology. Dental technology and community oral health, there's just one thing that separates them. In dental technology, they make prostheses, like they make implants for teeth. They fix braces for you. They help you in whitening your teeth, all those things, yeah? Cosmetic, basically, dental technologists. And then community oral health, they deal with like dental extraction, you see, like things like cleaning the teeth. Even the dental technology can also do the cleaning, but community oral health, they deal in the community and help people take care of their oral hygiene and support them. Diploma in optometry, it is dealing with the eyes. If you have eye issues and you go to a level 1, 2, 3, 4 hospitals, you'll always find an optometrist who will be able to have a look at your eyes and tell you either you need glasses, you're short-sighted, long-sighted. So they are first contact with them. When you have eye issues, they will help you, and then they will advise on what type of specs you'll need to use. Okay, we have diploma in nursing midwifery, and also we have diploma in nursing mental health and psychiatry. These are two different parts. Diploma in nursing midwifery, you do nursing and midwifery, like how to take care of antenatal mothers, how to deliver them when they need, then the time is due, how to deliver them. So these ones can deliver women, but the one for psychiatry, them they deal with mental nursing, how to take care of the mentally unstable patients. So those are two different levels of nursing. And then we have diploma in pharmacy. Pharmacy are the guys now, after now you've been seen by the doctor, the person who stays in the pharmacy, the person who dispenses, the person who advises the patients on this medicine doesn't go with this, don't take them together, take them morning and evening, and this other one take them during lunchtime because of ABCD. They will give you all that science around why you're not supposed to take with ABCD. So their advice, they are like the end game of treatment, because once you've been seen by the doctor, you've been prescribed, you've been taken to the lab, and then you're given medication and you don't take it well, so it means like the whole thing did not work. So like they're at the tail end of tying up those ends and making sure that the patient has gotten the rightful care that is needed. And they also advise the doctor that you've prescribed this medication, but this one will go well with this one, can you please change your, they discuss together and they give you the best care, that they give the patients the best care that they need. Okay, so yeah, I'm referring to you and as a patient and whatever, because I'm talking to the pre-service, so you take it like how you've gone to the hospital setting and how you've seen things roll around, and this is how it comes about. And I'm also talking to the parents who will also help in the career selection of their children. So yeah, where were we? We go to number 18. We go to diploma in orthopedic and trauma medicine. orthopedic and trauma medicine. These orthopedic are the people, orthopedic and trauma medicine, they are like they are the first people you'll meet if you've had a broken bone, or the doctors feels like you have a broken bone. He'll send you to that department, then they'll take up from there, send you for x-rays, and then put a plaster on you, put a cast on you, send you either for internal fixation, external fixation if you need one. So they'll give you an advice and then forward you to the respective place where you'll find that care. And then we also have diploma in orthopedic technology. Those are two different things. Orthopedic technologists are now these ones who help in walking aids. They will help you if you have either one person, there are people who have one leg is short, another one is long. So they make for you like prosthetics, like the leg, the shoe, they make for you the shoes, and they will fit you, and the other walking aids. Or if a child is born with clubbed feet, like feet that face each other like this and cannot straighten up, they are the ones who will come in and make whatever it is that child will need, or advice depending on what their pediatrician has found out, and then they will work together. So they deal in that department of rehabilitation also. Number 20, diploma in counseling. Those who deal with psychological issues, like sometimes you've gone to somebody goes to the hospital to be seen, but now after talking to the doctor discovers that there is more to psychological issue than the physical issues that you're having, or probably the psychological issues are the ones that are causing your physical issues, because your brain is powerful. It can cause you to be very sick, yet just the brain is sick, but the body is just tagging along to what is happening to the body. So they will send you for counseling, and then you'll have a counselor to deal with you and then talk with you, and then you'll come to a solution of what your problem is, and then take charge of your life once more. So this one, the career path, you will become a counselor. You can continue and do degree in counseling, and then you do your master's and then your PhD, wherever. You can come back into the teaching department, or you can continue as a practicing counselor consultant. Yeah. Diploma in community health. So community health diploma, they work together with public health. These are the ones who work on the ground, and they know this community, these practices they cause this issue to health, and then they advise the public health on what to do, and also they advise them they advise the health care workers generally what to do or what to champion for that particular community. And also we have now the new course that is in the market is the diploma in mortuary science. At last it is here. This one, when you come out, you become a mortician. And you are able to do embalming. You'll be able to do just basically prepping the body for the pathologist, and also helping in analyzing the results and all that. Yeah. So basically, it is long overdue, but finally it's here. It is a good course. This one, given a chance, I can do it on the side, because you get in there, you do your thing, nobody gets hurt. Yeah, you're giving the last respect, decent send off to loved ones, like last office work. Yeah, this one is long overdue, and we are happy it is here in the Kenya Medical Training College. So I'll just simply mention the 10 certificate courses, which are basically some of the certificate courses of the diploma courses we've talked about. And the only difference is that it's a certificate course. It is you do it for 2 years, lesser workload, lesser information on it, but you can as well come back and do a diploma, which might cost you like a 2-year. Yeah. So the only problem is if you did not attain the mean grade of C for you to get into the diploma course. Things happen during exam, and maybe this is what you wanted to do, but now you cannot qualify for it. So not all hope is lost. So you can as well do the certificate course and come back and upgrade. Certificate in all the other certificate courses, they require you to have a C-. Other than certificate in nutrition and dietetics, which will agree, you will be accepted with a D+. And there's another diploma here that I want to talk about, a certificate here that I want to talk about, certificate in health records and information technologies, for people who are already in service. If you're working in the records department as either a casual or someone with interest and you just found yourself working there, yeah, so you can as well, with if you have a D+, you can go and do this certificate, and then you'll do a diploma and then just take in your career, so that it is a good thing. But if you have to, and for an entrant who is not in service, you need a C-. Okay, yeah, basically that's about it. For certificate in community health nursing, you still need a C-. Yeah. Orthopedic and trauma medicine certificate, the same. So all the other certificate is C-. So we have certificate in nutrition and dietetics, certificate in medical engineering, we've talked about medical engineering, certificate in community health assistant, it's like community nursing. If you have done community health, certificate in orthopedic trauma medicine, certificate in community health, certificate in medical emergency technician. These are EMTs, emergency medical technicians. They are the ones who are always in charge of the ambulances, and they're like the first contact when you've needed an ambulance. They're the ones who will assess you and give you the first care. They're first responders. They'll give you the first care before you get to the facility. So they are very, very important. So if they mishandle you, you might not even end up in the hospital. So it is a very nice course, and you as well need a C- for you to get into it. So yeah, that's about it for today. And guys, in case there's a course I have just passed on and you did not get everything clearly the way you wanted it, there's a comment section below. Kindly just type whatever it is that you wanted a clarification on, and I will surely get back to you and we will have it clarified for you before you do the application. So from me, I wish you all the very best, and karibu sana in the medical field. It is a very fulfilling field where you help someone in whichever level, in whichever capacity you are in, and this person is able to get back to their normal health again. It is more fulfilling if you're doing it from the heart. But if you're coming to the medical field for money, you better think again, because you might have to, it is not a good thing. You might have to do some things to the vulnerable people, and it is not a good thing. So from me to you, it is bye, and see you in the next video.